You're listening to a Raconteur Studios podcast.
Welcome back to the After Hours Skin Clinic. I'm Dr. Emma Craythorne.
And I'm Dr. Ellie Rashid, and we're two consultant dermatologists who are all too aware that your biggest skin questions don't always come up in a clinic. They come up after hours.
So we're back to talk about a term that's been bandied about everywhere in headlines and in the social media, and that is Ozempic Face.
Now, if you're not sure what Ozempic Face is, don't worry, we're going to break it down for you. It's essentially the cosmetic effect that some people will notice after using these weight loss injections. So these are these GLP-1 receptor agonists. And one of those GLP-1 receptor agonists is Ozempic. And because that's the one that had lots of popularity on social media, the term is referred to as Ozempic Face. But actually, you can get it with all GLP-1 agonist drugs.
And in fact, anything that's going to make you lose weight at a very rapid pace is going to give you exactly the same thing. So GLP-1 stands for glucagon-like peptide receptor 1 receptor agonist. So that's why we shorten the term. And these have essentially gained huge popularity because of the ability in which they can help people to control their appetite and also the way in which fat is essentially stored in the body. Do you know where this comes from originally, this GLP-1 receptor agonist? Do you know?
Yeah, for diabetes.
But do you know where the actual hormone comes from? So it was originally derived from a lizard. It is true. And what they realized was that this lizard that lived in the desert, it only had to eat like 1 or 2 times a year, and it just wasn't ever really hungry. And then they took the saliva from this lizard and realized it was full of this hormone, this GLP-1 receptor agonist hormone. And it was from that they then derived this, and they started to use it in people who initially had diabetes, but also it was really about kind of control of appetite, because we know that if you were to give somebody a diet that was very calorie restrictive of say about 800 calories a day, you would be able to reverse that person if they were going into type 2 diabetes. So many people then followed this very calorie restricted diet and they reversed their tendency to type 2 diabetes. And so the idea is if you can calorie restrict, then this is possible, but it's incredibly difficult for our body to calorie restrict. And for a huge section of the population, you know, you are designed to build your body. Like that's what happens. You just put on weight to protect yourself and to essentially make yourself strong. So you are driven to eat. If you think about kind of like cave people times, if you didn't have a desire to eat, and then you just wouldn't eat, and therefore you would kind of fade away. So you have to want to eat. But part of the problem now is that there is so much plentiful food everywhere. And obviously all food is not equal. And some food is incredibly almost damaging for our body, really, how that food is made. You're programmed to get food. All of that food is readily available. You eat that food and then your body gets bigger. And unfortunately, in the world we live in, we are seeing a real obesity epidemic because of those two factors happening. And so GLP-1 receptor agonists have really almost been seen as an antidote to this. And for people who have type 2 diabetes, it's used in a way to control appetite, but also then to move over how their insulin is behaving and essentially reverse that tendency to diabetes. But also for people who are now in an overweight situation. So if your BMI is high. So in the UK, you have to have a BMI of 40 and one comorbidity in order to qualify for getting it from your GP.
Yeah, so you have to have a BMI over 40 and then you have to have one obesity-related complication. So whether that be something like high blood pressure, otherwise known as hypertension, type 2 diabetes, there needs to be something else, and then you would qualify from the NHS for being eligible for these GLP-1 agonists. But privately, the threshold is much lower. So I think privately, the threshold is a BMI of 30, and you don't necessarily need to have one obesity-related complication.
And I mean, we all know that it's actually being used where the BMIs are much less than that, but people are just struggling to kind of keep their weight at a level that they want to. And so it's also being prescribed for BMIs that are kind of even less than that.
I mean, it's being prescribed for women that have put on weight after a pregnancy. So just trying to lose your baby weight. People are taking GLP-1 agonists. It's given to people that are already slim with a healthy body mass index and are healthy, and they just want to lose more weight. And so they're also being given GLP-1 agonists. I think it's a real problem because actually diabetics that really require these drugs were then running into huge problems with stock issues. So I think it was the Kardashians that made it very popular, but certainly in the States, it became a real social media craze where lots of people were injecting GLP-1 agonists. Then it became popular here, and then the more and more that people were being prescribed it, the more of a shortage there then was for patients that genuinely needed it for health reasons. It is a very good drug, and it can be really beneficial for the right type of person.
I think it is an amazing drug for the right kind of person. I really do. I think of some of my patients, for example, who have polycystic ovarian syndrome, who have absolutely struggled with their weight. They are just designed in a way by their hormones to put on weight, and there's nothing they can do about it. You'll hear people say, oh, but I only eat like a lettuce leaf, or I only eat these kind of tiny amounts. And often in the past, I think people were dismissed about that. So there's no way that's all you eat. There's no way. But actually, for some people, the way that their fat is stored is really quite different. And the amount of energy that you need to maintain your kind of metabolic rate, it is different for different people. And so I think where particularly people with polycystic ovarian syndrome have really struggled, where they really find it difficult to lose weight. I think it's been transformative, and it almost forms the package of care for most of my PCOS patients now, where they have acne, they have their hair loss, they have hair growth elsewhere, and they're struggling with their weight. And, within a pretty short period of time, there is a huge difference in the fact that their menstrual cycle is now regulated, their acne has improved, and they're losing weight as a consequence.
I see so many patients that have inflammatory conditions where obesity can be linked to it and can drive those inflammatory conditions like psoriasis and HS, or hidradenitis suppurativa. And there is a real role of these GLP-1 agonists in having an anti-inflammatory benefit. So it's not just about losing weight. So, some of the drugs that we might give to someone that has psoriasis or HS, they're sort of fixed dose drugs where whatever your weight is. So if you imagine losing weight, then a drug at a fixed dose, there'll be more of that drug running around in a sort of 50 kilogram person compared to a 150 kilogram person. So sometimes the drugs might just work better because there's less body weight for that drug to be sort of working around, but also the drug seems to have an anti-inflammatory benefit in its own right.
Yeah, because I saw those two studies, both one in psoriasis and one in HS, where they had the patient on the GLP-1 receptor agonist drug, and actually there hadn't been any change in their weight that was meaningful, but the person's psoriasis in one case and HS in another case had improved, showing that it was probably more the anti-inflammatory effect of it rather than just related to the weight loss effect. And I've used it myself. I can think of in a patient who everybody had struggled with her rosacea. I mean, she'd honestly seen about 10 different dermatologists by the time I think she'd got to me. So I could already quite easily rule out, okay, well, that's already been tried. That's already been tried. And she did have a high BMI. And I just thought, you're going to get benefit from one of these drugs anyway. So let's just start a GLP-1 receptor agonist drug. And her rosacea had almost completely cleared at about 2 months. And that was the only modification I'd made to her regime. So I think there is a huge anti-inflammatory role of these. I also think it's quite interesting, if you've got something that's anti-inflammatory and you've got a general weight loss associated with it, it actually might be the solution to a lot of the knee replacements and hip replacements that might be happening.
To reduce the number that needs to be done. Yeah, gosh, the waiting lists are huge for knee and hip replacements. It would have a great benefit. I mean, there are so many health benefits. And one of the key things that patients will tell me that are on GLP-1 agonists is that it just has reduced the noise that they have in their head about eating, and eating sort of being the focus of their day and just not having to think about it anymore. It's just such a welcome break for them.
Yeah, because I think we take it for granted. I'm somebody that, if I go to the supermarket, I'll go in and get the stuff I need and I'll leave. That's if I go to the supermarket. I hate going to supermarkets. I'll just put that out.
Yeah.
But I'll just go in, I'll get the stuff I need and leave, and I'll eat whenever I truly feel hungry. But I could go the day and be engrossed in doing something and actually forget to eat. But I have other members of my family that be chatting to, and they're always thinking, okay, so where are we going to have lunch today? Where are we going to have dinner today? Walking through the airport, where are we going to pick up snacks? And, it's just constantly in your mind of thinking, okay, where am I going to go to get food? Like, where is this food going to be? And I think that idea of just reducing that noise is so helpful for so many people. We're talking about this and the effect that it has on the skin. So I want to talk about the good effects on the skin, first of all. So this idea of it being an anti-inflammatory, I really agree with that. I do see that there is this benefit in these patients that have these chronic inflammatory conditions. You've been seeing them for so long with their conditions, and then if they've then had one of these receptor agonist drugs added in, there is an improvement in their skin from that perspective. Like, that is my view of it that I'm seeing in clinic.
There is one thing I would say about these drugs, and it's the only slight part of my mind that not worries about them, but just I consider it. I sort of consider when we think about someone's appetite for life, and people celebrate with food, and it's sort of a big cultural component, and you all get together around a table and you're all eating together and you're sharing stories, and sort of food is quite central to that family coming together. I wonder sometimes, does sort of not having much of an appetite for food, does it affect those relationships and that sort of sitting down and the cultural component and the traditions of sitting around a table and eating together as family? It's the only thing that I sometimes think about. And I don't know whether it has any impact on that psychological aspect of eating.
I think it probably comes down to the dose, because typically how they work is you will start on a low dose of this drug and then the drug gets escalated. And I think then the further that you will go up the dose escalation of the drugs and the impact that will have. And I think if it's having too much of an impact in that regard, you would then end up moving your dose down. And I think that actually from chatting with the endocrinologist who I always work with these, their feeling is that the idea of going low and slow is really key, so that you're having an impact that's improving things, but it's not having that negative impact where you feel like you're missing out and you're not getting the joy from those kind of situations. But also that is going to have that impact on your skin as well, because the shape of our face is made up obviously with the skin on the surface, but it's made up with these fat pads, and the fat pads sit in a certain position, and those fat pads are obviously, by the name says, full of fat. You look at a little baby and they've got those big round faces just full of fat. Over time, our fat pads already start to decline. And that's why, if you look at somebody from the side, once they start to get to about their 40s or 50s, typically the face looks a little bit flatter in the middle because that fat pad started to be gone. But if you lose a whole lot of weight very quickly, then you get this accelerated nature of those deeper fat pads, and you get that very classic Ozempic face where the face does look more gaunt, but particularly in the mid part of the face. And I think that's obviously harder to recover then if you've done it quickly. And the older you get, like, these things are probably more recoverable in your younger years. But if you're doing those in your older years, it must be harder to get that back. So I think that really the dose is important, I think, for that joy of life component that you're talking about, but also the effect that it'll have externally whenever you look at somebody, so that they don't become too sagging.
Yeah, I completely agree. I think slow and steady wins the race. Like, just do it gently, low dose, lose the weight in a sort of steady state, not to suddenly sort of drop 10 kilos in a few weeks. That's very sudden weight loss is a thing that gives people that saggy, gaunt appearance. So you just want to minimize the chance of that happening.
I mean, there's a lot of skin changes that we see on our body as a consequence of hyperinsulinemia. So Hyperinsulinemia is where we're making too much insulin. And insulin in itself is a growth hormone, so it makes things grow. It also makes us store fat in areas that we typically are not wanting to store fat, and is the driver in conditions like polycystic ovarian syndrome and in type 2 diabetes. So you've just got more of this insulin, and it almost becomes like a bit of a vicious cycle. You're just making more of the insulin. But it also, when you make too much of the insulin, it makes things in our skin grow. And so you will see more skin tags. And typically they'll occur kind of around the neck. I can't tell you how many times you'll pick up in clinic as a dermatologist, somebody has type 2 diabetes because they've come in with all of their skin tags. Or if you look in the armpits, you might see a thickening condition of the skin where it looks like a dark velvety color. That happens in the armpits. It can happen around the neck. It can happen on the cheeks. And it looks like a very dark, kind of almost dirty like pigmentation of the skin, but it's actually a thickening of the skin. And these are all signs of where the insulin is too high. But it can be helpful for that as well, can't it?
Yeah, so I had a patient who has acanthus nigricans, a young girl, and she was obese. And she also had polycystic ovarian syndrome. And she started on one of these GLP-1 agonists. She started on Mounjaro. And honestly, within 3 months of being on Mounjaro, her acanthosis nigricans, so that thickening of the skin, that velvety thickening of the skin, completely resolved. She had it everywhere. Armpits, neck. She actually even had it on her anterior neck, posterior neck, all of her medial thigh, so the inner thighs.
Did she have it on her face?
She didn't have it on her face, no. And it completely resolved, like just back to normal. She was feeling great because she had lost the weight that she had been trying to shift for ages. And also with polycystic ovarian syndrome, quite often where you sort of store your fat is also quite different. So you often have this central obesity where the fat sort of stores in your abdomen, more male sort of distribution of fat. And so it completely improved. She was absolutely delighted. But the thing that made the biggest difference to her was actually the acanthus nigricans completely resolving.
Yeah, I mean, it is amazing. And even things like skin tags, you'll just not be making the same amount of skin tags just because you don't have that high level of insulin anymore. So for people who have undergone a rapid weight loss, and that might be from bariatric surgery, it might be from these GLP-1 receptor agonists, it might be from being unwell for many reasons. People can lose weight rapidly. Should we go through what we think can be helpful if you do have this Ozempic face? In other words, loss of that fat pads and the skin becoming more saggy?
I think that probably the most effective thing to do is hyaluronic acid filler treatment. So that can just help restore some of the lost volume and can help improve that sort of light reflex so that you've got those curvatures on the face that helps reflect light off it and often gives a more youthful appearance. So yeah, probably number one thing for me would be hyaluronic acid fillers.
I would agree. I think that, what you're trying to do here is restore a bit of, volume, and an in-clinic procedure or filler injections. And I think that is really the answer if that's the problem. The skin overlying it also typically has been stretched, and the older you are, the less likely your skin is to recover that bounce in quite the same way. So, some of the more stimulatory skin treatments, so things like microneedling radiofrequency, might be helpful as well. So it'd probably be a combination of both of those things. One of the things to address that outer part of the skin, and then the second would be to address the fat pads that have been lost.
I mean, even sometimes doing botulinum toxin injections can be helpful because that also helps with the elastic recoil in the skin. So a combination of like filler, botulinum toxin, radiofrequency microneedling, I think those sorts of treatments are what will probably make a difference. I guess another thing that one can do to just help improve the structure of their skin and support their skin as best possible is to use ingredients that are really good at building collagen and improving light reflex, skin cell turnover. And the ingredient, of course, is
tretinoin. In unison.
So something like Clearer that has tretinoin in its gorgeous base that you can use very easily to help support your skin structure would be perfection. And then, of course, also to protect and prevent sun damage, because that can break down some of the collagen. So wear your sun protection, as if you haven't had that enough already on this podcast. So doing things like that can just help support your skin structure so that you can optimize your skin, so that when you are losing the weight, it can sort of catch up and be as resilient as possible.
Yeah, I mean, I always think of everything in layers, as you know, and the most important thing is that layer on the outside that everybody's looking at. So that's your tretinoin and your SPF. And then once you get a little bit deeper, it's things like your botulinum toxin injections. Deeper again, we think about fillers of how you can restore that volume. And then sometimes it's also about being a bit realistic, because if you have lost a dramatic amount of weight, then the idea of even trying to catch up with fillers might end up looking too pillow facey or distorted. And perhaps if you really are somebody who has lost a whole lot of weight and your skin is stretched, then often in those situations, it is surgery to remove the excess skin is the thing. And from the plastic surgeons I speak to, that is something that is now, starting to become a lot more commonplace, because, if you've lost a whole lot of weight from your abdomen, unfortunately, you will still have what's called an apron hanging down. And, no matter how thin you've become, often that apron can hang right down to your knees. And it is just skin. And it's the removal of that skin that often the plastic surgeons have to undertake. And the same thing can happen with the face as well. And although we keep talking about Ozempic Face, I actually couldn't tell you the last time I saw a patient who was on Ozempic, because they're all on Mounjaro.
Yeah, same. The trend has definitely changed.
So we should call it Mounjaro Face.
GLP-1 receptor agonist face.
And I actually also think that it doesn't happen so much on Mounjaro, because they've also learned the lesson from Ozempic. Ozempic was like super popular and everybody went onto it and lost weight probably a bit too quickly. Whereas by the time Mounjaro, which is tirzepatide, has come round, they've learned the lesson of, not losing the weight too quickly. And so maybe Mounjaro Face will just actually not ever exist, because people have learned to take it more slowly. So whether you're already using weight loss injections or just considering, the takeaway is this: there are pros, and there are a lot of pros to these medications in the right people, that's for sure. And there are cons, and your skin might change along the way.
And I guess if you're noticing signs of Ozempic Face, then you're not alone. It's common and it's a part of weight loss. And it's more apparent if there's a dramatic weight loss. But the good news is that there are effective ways that we can manage it.
And let's not forget, even when we think about the effects that this can have on the skin, the real benefits that we see in patients who have acanthosis nigricans and inflammatory skin conditions like psoriasis or rosacea or hidradenitis suppurativa, these medications can be incredibly helpful.
And we're not trying to scaremonger people. We just want people to be well informed and to make positive decisions to optimize their skin health and just optimize their mental health and make them feel better.
And if you've got more questions or there's a skin topic that you'd particularly like us to explore, well then please leave us a message or a comment, and all the details are in the show notes.
And if you've enjoyed today's episode, don't forget to rate, review and subscribe. It helps others find us too.
So take care of yourself and your skin, and don't forget to wear your SPF.
See you next time on the After Hours Skin Clinic.
As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.